but it was a requested video, a day in the life of an oral hygienist. What a busy day. What a busy day. The time is 11:48, so it's about to be 12. I came in at 9 and I have not even taken a break because I've been seeing back to okay, let's quickly do it. The things we do so confident. Okay, you just open it, the powder. Okay. This thing jumped on my eye last time. Oh. I'm scared of it. Back together. Open. I forgot to ask about something too. No, just wait. Okay. You can just place it on her. Yeah. Okay. Upside down. Capture the end product. Okay, there we go.
So preferably after work.
Preferably after work, yes.
Because I need to speak.
Oh, you speak it? What do you do?
I speak for a living. I work on radio.
Oh, that's so cool.
So,
which station?
YFM.
YFM?
Yes,
that is so
cool.
cool.
Speak.
That is so cool, Pan.
You like, do they do anything now?
Taking pictures and shit.
Oh, thank you. I feel so much better already.
That's awesome.
So
That's
I'm able
awesome.
to go eat, right?
Yeah, you are able to go eat. Maybe just give it like 30 minutes though, because we want the fluoride that is in the polish to get absorbed in the teeth. But just give me your handle on Instagram so I can get my pictures.
Sure. Sepi
Sepi
_. MABS.
MABS is right here.
Yeah.
Oh, 11K, man.
Oh, stop it. I will see you.
Pictures. Look at your DMs. I don't know if you guys
I
look at
do.
DMs.
I can't see all my DMs.
All right,
Okay.
then enjoy the rest. Okay, so let me run you through what happens at the end of each patient visit. There's admin that you need to cover. So sometimes you're not able to cover it after the one particular patient or a few patients because there's back-to-back patients. But as soon as you find an opportunity, you need to cover it to check if medical and dental details have been entered correctly on each patient file, that helping with continuity of care. And that also being a standard for good record keeping. You also need to date the radiographic image that you have taken as evidence for future treatment and to ensure it does not get mixed up with previous patient records. Also ensure to write what will be done on the next visit to ensure that there will be continuity of care when the patient comes back again. And then place the patient on the diary for the next visit, which will be in 6 months' time. This will ensure that the patients are reminded when they're due for their next appointment. And ensure all ICD-10 codes have been entered correctly. This will facilitate with the medical aid claim. Thank you. Hello. How are you doing?
Very good, how are you?
I'm well, thanks. Hello. How are you doing? What's your name? T. Oh.
Wow.
Oh.
Is
it TSO?
It's still.
So
I guess people struggle.
So she spells it.
Yeah, people struggle to. Yeah.
Wow. Okay. Welcome TSO. My name is Lisa.
Hello.
So who am I treating? Her. Okay,
yeah.
cool. You want to sit on my chair?
Okay.
Is there a problem? that you
Yeah,
have
she's
to-
got overgrown too.
So it's quite explainable because I mean it's just effects of gum disease because of you not having a clean. So with the cleaning cases, it kind of differs really because some patients come in with what we call gingivitis, which is more easier manageable because I mean it's the progression of gum disease. But then some patients come in with what we call a periodontitis when the gingivitis has progressed and it started to affect the surrounding tissue, so be it bone, ligaments, and it's the teeth or the surrounding structures which support the tooth or the teeth start to break down. So I've seen multiple gingivitis cases and it was quite easy to clean them and take care of the patients and give them a good prognosis. But however, it was quite interesting to deal with the periodontal cases because there were quite a few of them, and when we took the radiograph, the x-ray, so we can be able to see the extent of the bone loss and the progression of the disease, we're able to see some extensive cases. So it was quite interesting really to see all of that. So for patients who have periodontitis, they're expected to come in more regularly for their dental cleaning. So instead of every 6 months, they have to come in every 3 months because now we need to take care of the immediate problem and we need to revert the gums back to health. So we have to revert the gums to health. We have to ensure that the supporting and the surrounding structure is reverted to health as well, so we can be able to ensure proper function of the teeth and prevent any tooth loss as a result of periodontitis. So I've seen multiple cases today and it was quite great really. I've been quite busy. I have looked at my camera and my phone for like only 2 seconds today because it was quite a busy day. And also the parts that also are involved and are quite essential in oral hygiene is the admin guys. So I have like patient files here. I have patient files where you literally have to look through each and every file. You're looking for the medical aid benefits. You're looking for if the patient is able to pay for the particular treatment or the plan of treatment that has been presented, if they will be able to manage it according to their medical aid, and if they will not be able to manage it, then they have to be able to agree if they will be paying it cash, so if they will be able to pay for the deficit. Anyway, the admin part is kind of the most hectic really, because you can't forget anything that you've seen in the patient's mouth. You need to record it as you have seen it in the patient's records, so that even if there is litigation, then you have the records of everything that has happened in the clinical session on record. So if you do not keep records, then it's very easy for you to miss information, and for when the information is requested, you will not be able to give proper representation of the case that you were dealing with. It has been a wonderful day. I have learned a lot. It's always quite exciting for me to come for work or either shadowing, because I genuinely love the clinical side of dentistry. I mean the theoretical side, yes, but like the manifestation of the theoretical side, which is the practical, I love it. So the patients I've seen have been amazing, and also I saw a baby, and we were not able to give the baby treatment per se because she was only 5 years old. She presented with what the dad called an overgrown tooth, but it was not an overgrown tooth because that tooth is supposed to be there. It was a lower central, a lower incisor, right? And it's a baby tooth, so you're expected to start shedding your teeth between the ages of 5 and 6, right? They're supposed to start shedding. In essence, give the child time to shed their teeth. There may be pain associated with the shedding, hence you need to use like pain management medication. Could be paracetamol, it could be Nurofen, like the syrup for the children, but instead of us dealing with the child and taking out that tooth ourselves, we had to leave it and let the child go home and continue eating, that tooth will come out by itself. So it was quite also interesting to see that, because not all cases that you see in the dental clinic will be manageable. Some cases it's something that's normal, but because the father or the mother is apprehensive, you need to be able to give them assurance in terms of the normality of the situation. So it's normal. The children are supposed to have their teeth, and some teeth will shed and some will be painful while shedding. It's a normal process, so it doesn't need intervention. In essence, with everything that I've said, every clinical case presents differently, and in it presenting differently, you need to be able to manage it differently, and not all cases will be dealt with necessarily the same way. Some things are just normal and should just be left as they are. However, this is the end of the video, and I'll chat to you guys next session. Please do leave a like, subscribe, and please do leave a comment down below, and what would you like to see more on the channel.